Hello, and thank you for attending this presentation titled Genetic Counseling for Lynch Syndrome. Am I at risk? My name is Jessamine Nazari. I'm a genetic counselor. And so to talk to you a little bit about myself, I was born in Puerto Rico. I lived in Mexico City a number of years prior to coming to the United States. As far as my education background, I obtained my bachelor's degree in biology from the University of Miami. And then I did my master's in genetic counseling and I obtained a degree from University of Colorado. I have been a genetic counselor for 6 years and I've worked in different settings, mainly in adult cancer settings. So I've worked at a radiology company in Denver, Colorado. I then worked as part of the cancer center of Yale New Haven Hospital in Connecticut. And more recently, I've joined one of the genetics laboratories called Marriage Genetics. And so today I'm going to be talking about Lynch syndrome, which is a genetic condition that predisposes for certain types of cancers, including colorectal and uterine cancers. So as far as the objectives of this talk, I do hope that after the presentation, you can identify some of the factors that raise a suspicion for hereditary cancers, that you can learn about the process of genetic counseling and testing for Lynch syndrome, and that you understand the implications of a positive genetic test result. So in terms of what that means for your management, but also the importance of sharing those results with family members. So I first want to talk a little bit about cancer in general. So most cancers are not hereditary. In fact, most cancers fall under this category that we call sporadic, which is represented by the blue color in this pie chart. And sporadic cancers are going to be the vast majority of cancers we hear about in the general population, usually happening at later onset, at advanced ages, and typically, or many times, in people that don't have a significant family history of cancer. Sporadic cancers are caused by a combination of different things. So, for example, just normal aging process, environmental factors, lifestyle factors, all of that can play a role in just a sporadic cancer developing in a person. In contrast, about 5 to 10% of the times we think cancers are actually hereditary, which is represented by this green piece of the pie chart. And hereditary cancers are ones that there is a single gene change that's running in a family, predisposing those family members to higher risk for certain cancers. Now, in about 20% of cases, we say cancers fall in the category of familial. What we mean by this is these are families where we tend to see clusterings of cancers in a family, but we don't really have one single genetic explanation for that history. A lot of the times, this clustering of cancers may be due to shared environmental factors or even shared subtle genetic changes, but not typically due to one single change running in that family explaining that history. So what does it mean when someone says cancer is hereditary? In order to best describe this, I'm going to start by talking about sporadic cancers. And so I'm going to use this diagram here. This circle in this diagram represents cells in our bodies. So what happens in sporadic cancers is somebody is born with healthy cells. As time goes by, these cells may start to acquire genetic changes or mutations, which are represented by the X in this diagram. And so again, these accumulation of genetic changes happen normally. They may happen just due to normal aging process, environmental, lifestyle factors, and typically as time goes by, these genetic changes accumulate, but the cells are still working normally. It may get to the point, however, where there's just a lot of genetic changes in a cell that causes that cell to lose control and start dividing uncontrollably, thus becoming cancer. What happens in hereditary cancers is somebody's already born with a genetic change in all of his or her cells in the body. So that person is one step ahead in this process. And so because of that, people that have hereditary conditions, that probability of a cell becoming cancer is higher. And so that's why we can see people having these genetic conditions have higher chances for certain cancers in their lifetime. So I said not all cancer is hereditary. I do want to start by giving you some general facts about colorectal cancer. So in the general population, colorectal cancer is quite common. It's about the 4th common type of cancer in the US. about 1 in 23 men and 1 in 25 women will develop this cancer in their lifetimes. That means that a person has about a 4.2% lifetime risk of developing colon cancer, just by chance or just sporadic. Most of these are diagnosed after the age of 50, most commonly between ages 65 and 74. And again, 5 to 10% of colon cancers are felt to be hereditary. Now, to give a little bit information about uterine, or sometimes called endometrial cancer, it is the 9th most common type of cancer in the US. About 1 in 32 women will develop this type of cancer, which means that women have 3.1% lifetime risk of developing this cancer in their life. Most of the uterine cancers are also diagnosed after the age of 50. And again, about 5 to 10% of uterine cancers are felt to be hereditary. So if not all cancers are hereditary, you may be wondering what makes a doctor or a doctor suspicious that there might be a genetic condition in a family that has these cancers. And so for that, healthcare professionals, doctors, genetic counselors, they look to get clues from a family history. And so these are some of the red flags that genetic counselors or doctors are looking at a family history to start wondering or start getting concerned about the possibility that there is an underlying genetic explanation to that cancer in that family. So for example, whenever we see colorectal or uterine cancers diagnosed at young ages, typically under the age of 50, that can start to raise some suspicion. Whenever we see multiple family members affected in the same side of the family. Also, when we see presence of other cancers in a family, so in addition to colorectal and or uterine cancer, we see other cancers like stomach, ovarian cancer, small intestine. A combination of those cancers can also raise some red flags. And when it comes to colorectal and uterine cancers, a lot of those tumors are sent. When someone's diagnosed with those cancers, those tumors are typically sent for further analysis through pathology. And sometimes those pathology results can indicate a high chance that that cancer was due to a genetic condition like Lynch syndrome. So sometimes those results can help guide doctors determine which patients might have this condition. So if you think you have some of those red flags in your family, the best next step would be to talk to your doctor. Your doctor may feel comfortable, may have sufficient knowledge or expertise in this condition, and so they may feel comfortable evaluating you further for it and even coordinating genetic testing. But some doctors, what they might do is refer you on to genetic counseling so that you can meet with a genetic counselor for further evaluation, discussion of your options, and a lot of the times the genetic counselors are then the ones that order the genetic testing. If genetic testing is ordered, then the next step, of course, would be to wait for those results, and either your doctor or a genetic counselor would be the person to review those in detail with you. So who are genetic counselors? I know I've mentioned genetic counseling and genetic counselors already several times. So just to give you some information, the definition by the National Society of Genetic Counselors is that genetic counselors help people understand and adapt to medical, psychological, and familial implications of genetic contributions to disease. A genetic counselor specifically is a healthcare professional who holds a master's degree and has expertise in medical genetics and counseling theory. If you've been referred to a genetic counselor or you're interested in visiting with one, it may be important to get a sense as to what happens typically during a visit. And usually people visit or have either 1 or 2 consults with a genetic counselor. So usually during that first consult, the genetic counselor will do an intake and basically review your personal and family history of cancer in detail. Typically, a genetic counselor will draw your family tree and they'll ask you about cancer in the family, not only in close relatives like your parents or siblings, but also in more distant relatives like aunts, uncles, grandparents, cousins. So it is important to try to investigate what cancers are in your family, even if it's in more distant relatives. And the important thing to know is what type of cancer that person in your family had and at what age was that person diagnosed. Again, the reason why details matter is because we're using the family history as a tool to assess whether there could be an underlying genetic condition in this family that is explaining that history. So knowing that information is helpful. We know it's not always possible to get all the details, but as much as you can gather, that would be the best. Once the counselor has obtained that information, then the counselor can make a risk assessment and determine the probability that there is a genetic condition explaining that cancer history, and then proceed to talking to you a little bit more about cancer genetics in general, talking about the testing options, so you can make an informed decision as to whether or not that's something that you want to proceed with. If testing is going to be done, then a lot of the times the genetic counselor will be the one that coordinates all of that, so they can coordinate the sample collection, get all the paperwork, go through the consent process. Once testing is done, and then typically for the sample collection, it's typically either blood or saliva sample, so it's pretty straightforward to obtain. A lot of the times it's done the same day as the consult with a genetic counselor. They're sent off then to, or the sample is sent off then to a laboratory for analysis, and then the next step would be to wait for the results. Your doctor or the genetic counselor would then be the ones to disclose these results with you and interpret those results in the context of your personal and family history. Many times a genetic counselor might be able to give you additional resources, more information that's, credible. There's a lot in the internet that you can find, but, credible information that may supplement your results, or even some information about some local support groups if that's something that the patient would be interested in. So we've talked a lot about what are the red flags that providers and genetic counselors look for in a family, what's the process of genetic counseling and testing. But now let's get into details as to what would be the specific genetic condition that we think about when we're considering hereditary forms of colorectal and uterine cancers. So again, what we're going to be focusing on is this particular condition called Lynch syndrome. This is the most common cause of hereditary colorectal and uterine cancers. Both men and women can have this syndrome. And it's important to know that individuals with Lynch syndrome can also have elevated risks for other cancers in addition to colorectal and uterine. So we're going to talk about that next. So some of the types of cancers that have been seen in families with Lynch syndrome, again, we're talking about for women. Women are going to be at highest risk for colorectal and uterine cancers. However, women that have a diagnosis of Lynch syndrome may also have elevated risks compared to the general population risk for other cancers like ovarian, stomach cancer, small intestine, urinary tracts, among others. Men who have a diagnosis of Lynch syndrome, again, the highest risk is typically going to be for colorectal cancer, but again, we can see some other cancers being elevated like stomach cancer, small intestine, urinary tract, and others. Now, just because all of those cancers have been linked with Lynch syndrome, that does not mean that a person who has a diagnosis of Lynch syndrome will develop all of those cancers. In fact, someone who has a diagnosis of Lynch syndrome, that doesn't mean that that person will develop cancer with 100% certainty. What it means is that that person's lifetime risk for certain types of cancers are elevated compared to the risk that we see in the general population for that same cancer. So that's what you're going to see with this graph here. The blue bars represent the risks for these cancers in someone who's diagnosed with Lynch syndrome compared to the risk of the same cancer in the general population, which is represented by the green bars. So again, the most highest risks cancers that we see with Lynch syndrome are going to be colorectal, uterine cancer for women, but we can see some other cancers as well being elevated over the general population risk. And again, important to know is that some of these cancers can be significantly elevated compared to that general population. But again, it doesn't mean that having this diagnosis, that alone does not mean that person will develop the cancer with 100% certainty. So generally speaking, people that have Lynch syndrome have elevated cancer risks compared to the general population. Now, the specific cancer risks do vary depending on the specific type of gene change in a family. And so we're going to talk a little bit about the genetics of Lynch syndrome next. So Lynch syndrome is caused by a gene change or a mutation in one of certain genes. So I've listed out the name of the genes that are linked to Lynch syndrome. So basically, when someone is born or someone has a genetic change or a mutation in one of these genes, then that person has a diagnosis of Lynch syndrome, which means that person has elevated risks for certain cancers in their lifetime. Let's talk a little bit further about how someone can inherit a mutation in one of these genes. The first thing to note is that we all have these genes in our bodies. We all have actually 2 copies of these genes in our body. So this purple rectangle represents a gene. And so I said we all have 2 copies of these genes in our bodies, and that's because we inherit 1 copy from dad and 1 copy from mom. So when both copies of these genes are working normally, then that person does not have Lynch syndrome. But if someone inherits a gene change or a mutation in one of the copies, in this case, this person's inheriting a mutation from the copy coming from dad. So when one of those 2 copies of genes has a gene change or a mutation, then that person has Lynch syndrome. That person has higher chances for certain cancers. Now, it's important to know that gene change or mutation could have come from dad's copy. It could come from mom's copy. It doesn't matter. The bottom line is that if one of the 2 copies of the gene has a mutation, then that's what gives a diagnosis. So you may be wondering, okay, so what is the importance, or what's the purpose of even knowing that there's a mutation in one of these genes? And the idea is that because those certain cancer risks are elevated, there are actually options to manage those risks or even try to reduce those risks. So generally speaking, people that have Lynch syndrome will start certain types of cancer screenings at younger ages. They may do them more frequently, and they may also consider risk-reducing strategies. The specific management plan may depend, again, on several factors. One of them being the specific gene change in your family. And again, just because, as I was saying earlier, there are different genes linked with Lynch syndrome, and the cancer risks associated do vary depending on which gene we're talking about. And so your specific management plan may depend on your specific genetic test result, also your personal and family history and personal preferences. So it's important to have a conversation with a provider that has expertise in Lynch syndrome so that you can come up with a plan that is appropriate for your specific situation. Now I know it's a busy slide, so let me just give some background and then we'll go through some of this in more detail. But there are some national guidelines that have been put in place by medical societies. These guidelines are there to help doctors know what specific screenings and risk-reducing strategies they should consider for a patient who has Lynch syndrome. And so in order to address colorectal cancer being significantly increased in someone who has Lynch syndrome, a lot of people with that diagnosis of Lynch syndrome will start colonoscopy screenings at a younger age, so typically between the ages of 20 and 25, instead of waiting till age 50, which is what is typically recommended in the general population. So they'll start with colon cancer screenings at younger ages and repeat them every 1 to 2 years, so they tend to get them more frequently. In order to address uterine cancer, there are several options. There may be screening options like doing transvaginal ultrasounds and uterine biopsies. It is important, however, to have a conversation with your doctor about the benefits and limitations of screenings, because not all screenings are going to be equally effective. So it's always important to really get a sense of the benefits and limitations so you can make the best decision for you. Some women that have Lynch syndrome, a lot of the times they may consider then removal of the uterus after having children as a way to try to reduce the risk for developing that cancer. Likewise, I said some women with Lynch syndrome might have elevated risk for ovarian cancers. So again, they could consider some screening options like transvaginal ultrasounds or checking blood for some specific markers. Or again, there's that option, risk-reducing surgery option of removal of the fallopian tubes and ovaries after having children as a way to reduce the risk of getting that cancer. I mentioned earlier there are other cancers that may be linked with Lynch syndrome. And so depending on your results or your family history, additional screenings for other cancers may be considered as well. So again, important to review your results and your family history with your doctors and genetic counselors. If you have Lynch syndrome, it is important to share your results with your family. So if you're found to have a mutation, we know other family members could have that same mutation as you. They may also benefit from more screenings and other risk-reducing strategies. Specifically, if you're found to have a gene mutation, that would mean that each of your siblings from the same mom and dad as you and your children would each have a 1 in 2 chance or a 50% chance of having that same mutation. So always make sure to share your results with them so that they can then follow up with their doctors or a genetic counselor. And one last thing I want to say about genetic testing is there are different testing options that are available nowadays. Some providers may talk to you about testing only for Lynch syndrome based on what they're seeing in your personal and family history. But a lot of the times, especially nowadays, a lot of doctors and genetic counselors are talking about the option of doing more extensive tests, which we call panels. So they can do a bigger test that looks at the genes related to Lynch syndrome, but also look at other genes that have been associated with hereditary forms of colorectal, uterine, and other cancers. In this talk, we mainly focus on Lynch syndrome because that is the most common genetic condition explaining most hereditary forms of colorectal and uterine cancers, but that is not the only genetic cancer condition out there. And there are other genes that have been linked with some of those cancers. So it's always important to discuss your testing options in detail with your provider or a genetic counselor to ensure the best testing approach for you. So some key takeaways that I hope you can remember from this talk when you're talking with your family or your providers. Again, not all cancers are hereditary. Knowing the types of cancers, ages of diagnosis, and number of people affected in a family helps to determine if there's any suspicion for a hereditary condition in that family. In order to determine if there's Lynch syndrome in a family, the person would need to undergo genetic testing, but there are genetic testing options. There are different genetic testing options, so it's important to discuss with your doctor or a genetic counselor what those are and what's the best approach for you. Testing positive for a gene mutation may indicate a higher cancer risk, but there are several ways to manage those risks. And so again, it's important to really review those results in detail with your doctors, get referred to specialists so that they can further discuss some of those options in more detail, and you can decide on a management plan that works for you. And lastly, share your test results, your genetic test results with your family members. It is important. They can then determine what that means for them as far as their risks and their management plan. Thank you so much. I hope you found this information useful. If you want more information about genetic counseling or finding a genetic counselor in your area, you can always visit this website, www.nsgc.org. Thank you.